Good afternoon. Okay, thank you so much to everyone for joining us today. We will be, as a reminder, using National Press Theatre rules. So I will invite each reporter up to the microphone in turn to ask your questions. We are joined today by Deputy Prime Minister Chrystia Freeland, Intergovernmental Affairs Minister Dominic LeBlanc, Transport Minister Omar Alghabra, and Health Minister Jean-Yves Duclos. Pardon me there. Okay, so I believe we have a number of opening statements here, so I will hand the floor over to the ministers. Please go ahead.
So, good afternoon, bonjour, it's Dominic LeBlanc. As you noted, I'm joined today by my colleagues, the Deputy Prime Minister Chrystia Freeland, Ministers Duclos and Alghabra, and Doctors Tam and New. Last night, as you know, the Prime Minister convened a First Ministers meeting with all premiers to discuss the Omicron variant. Prime Minister Trudeau said, "We know how seriously we as a country have to take this threat." He used the opportunity to discuss with premiers lessons learned in past waves of COVID-19, knowing that the fight against COVID is not yet done. Le Premier ministre a également souligné le soutien immédiat que nous allons apporter aux provinces et aux territoires. Nous leur enverrons des cargaisons de doses de vaccins de rappel et des tests
well as rapid
afin qu'elles puissent rapidement
so that they can quickly ramp up their vaccination campaigns and ensure that Canadians have easy access to rapid tests as well.
Les premiers ministres ont convenu
The premiers agreed to work with Ottawa
ensemble dans l'intérêt des
in order to
Canadiens
protect Canadians
afin de les protéger
from the
du
Omicron
variant
variant.
Omicron. As we have said from the beginning of this public health crisis, the Government of Canada will be there to support Canadians. We are asking Canadians to be cautious heading into the holiday season. If you do not have to travel internationally, please do not. Our government will continue to do everything we can to protect Canadians and to work with provinces and territories collaboratively during this pandemic. Merci beaucoup, et j'inviterai maintenant mon collègue, le ministre de la Santé, Jean-Yves Duclos, à prendre la parole. Alors, Jean-Yves, à toi.
Merci beaucoup, Dominique, et merci à tous d'être présents.
Thank you all for being here.
Aujourd'hui, j'aimerais faire le point sur la situation actuelle.
Today I'd like to give an update on the current situation and what we can expect in the coming weeks.
Il sera aussi question des nouvelles mesures que nous
I'll also
mettons
give
en
an
place
overview
à
of
nos
the new
frontières
measures that
pour
we will be
les
putting in
voyageurs.
place at the borders
Today, I want to talk to you
for
today about
travelers.
two things. First, the current COVID-19 situation in Canada and what we can expect in the weeks to come. And second, the further actions we are taking to strengthen our defense against the Omicron variant. Comme vous avez pu le constater vous-même lors de la présentation de Dr. Tam et de Dr.
During the
New
presentations
vendredi dernier,
by
la
Dr. Tam and
situation
Dr. New on
épidémiologique
Friday,
évolue
the
rapidement.
epidemiological situation is
Les
changing
informations
rapidly.
dont nous disposons
The information that we currently
laissent
have
entrevoir une
suggests
importante
a significant
résurgence des
resurgence
cas
of infection,
d'infection, et cela
even without
même sans
taking into
prendre en
account the
compte le
new
nouveau
Omicron
variant
variant.
Omicron. À l'approche de la période des fêtes,
As we
un
approach
seul
the holiday
principe
season,
continue
one
à
principle
guider nos
continues to
actions,
guide our
la
actions:
prudence.
prudence.
Depuis 20 mois,
For the
notre
past 20
gouvernement,
or so
en
months,
collaboration
our
étroite
government,
avec les
in
provinces et les
collaboration with
territoires,
the
n'a
provinces and
ménagé aucun
territories,
effort dans
has been
dans
working
la lutte
extremely
contre la
hard to
COVID-19.
fight
Les
COVID-19.
Canadiens de partout au
Canadians
pays
from
ont
across
aussi
the country
fait leur part.
also did their
Nous avons
part.
tous dû faire des sacrifices
We've
et
all had to make
respecter des
sacrifices
mesures
and
sanitaires
had to respect
strictes.
health
Nous
measures.
avons, en très grand nombre,
Many
fait
of us
notre
have
devoir
done our
citoyen
civic duty
en
by
acceptant
getting vaccinated.
de nous faire doublement vacciner. Ces efforts collectifs
These
nous ont
collective
permis de faire
efforts have
d'immenses
enabled
progrès.
us to make
Mais comme
great
nous le voyons
progress.
avec Omicron,
But as
le
we've seen with
virus
Omicron,
aussi
the virus
a pu s'adapter.
too has adapted.
Dès que le nouveau variant a été identifié, notre
As soon
gouvernement
as
a
the
mis
new
en
variant was
place
identified,
d'importantes mesures
our
de
government put in place
protection et de
extensive
restriction
border
aux
measures
frontières
to
afin de
slow the
ralentir
spread of the
autant
new
que
variant
possible
into
la
Canada as
propagation
much as
du nouveau
possible.
variant au pays. Nous savons maintenant que la
We now
transmission
know that
communautaire
community
est présente
transmission is
partout
present
au
in
pays
Canada, and just about everywhere else in the world. Whether we like it or not, we must accept this reality. We will need to adapt. We will need to stand together and do everything in our power to protect our healthcare system and our frontline workers. They have been on the front lines for us for over 20 months now. Like all of us, they are tired of the pandemic, and it is now up to us to protect them. So today, I have the difficult task of confirming that our government is officially advising Canadians to avoid non-essential travel outside the country. To those who are planning to travel, I say very clearly, this is not the time to do so. The rapid spread of the Omicron variant on a global scale makes us fear for the worst. Canadians who travel could contract the virus or end up stranded abroad. An official notice of this travel advisory will be posted very soon on the website travel.gc.ca. I can also confirm that we will continue to increase our testing capacity at the border and that we will have other announcements in that regard soon. These measures will be in place for 4 weeks, after which the situation will be reevaluated. I know that these measures may seem drastic to many, but we must avoid overloading our hospital system at all costs. I know that we're all tired of the pandemic, but I must call on the solidarity of all Canadians. Our governments, of course, have a role to play, but we all also have an individual responsibility. We need to increase the administration of border doses and expand the use of rapid tests. In both of these cases, our government is responding to the requests of the provinces and territories. The rapid tests are available, and deliveries have already started for the month of December. 85 million of these tests were already distributed before December, and another 35 million are being distributed to the provinces and territories. Many others will be made available following Minister Freeland's important announcement yesterday, and $1.7 million will be dedicated to this task. Vaccines are also ready and available to be distributed to the provinces. 16 million doses are currently in our inventory in Canada, either in federal government stockhouses or held by the provinces and territories, and millions more will be arriving in the country. Our window of opportunity is small, but we do have the power to change the course. Collectively and individually, we all have a role to play. The key word for governments and for citizens must be the same: prudence. I will now repeat in English. As you saw during the presentation of Dr. Tam and Dr. New last Friday, the epidemiological situation is changing rapidly. The information currently available suggests a significant resurgence of infections, even without taking account the new Omicron variant. As we approach the holiday season, one principle continues to guide all of us: prudence. For the past 21 months, our government, in close collaboration with provinces and territories, has been working hard to fight COVID-19. Canadians from across the country also did their part. We all have had to make sacrifices and have had to respect strict health measures. Many of us, the vast majority of us, have also done our civic duty by getting vaccinated. These collaborative efforts have enabled us to make great progress. But as we see with Omicron, the virus too has adapted. As soon as the new variant was identified, our government put in place extensive border measures to slow the spread of the new variant into Canada as much as possible. We now know that community transmission is present in Canada and across the globe, and in some circumstances, extremely rapidly. Whether we like it or not, we must therefore adjust to this reality. We must stand together and do everything in our power to protect our healthcare system and our frontline
healthcare workers. They have been on the front lines for us for the last 21 months. And like all of us, they are tired of the pandemic. It is now up to us to protect them. So today, I have the task of confirming that our government is officially advising Canadians to avoid non-essential travel outside Canada. To those who were planning to travel, I say very clearly, now is not the time to travel. The rapid spread of the Omicron variant on a global scale makes us fear the worst for Canadians that may think of traveling. Traveling Canadians could contract the virus or get stranded abroad. Official notice of this travel advisory will be posted on travel.gc.ca within the next few hours. In terms of arrival testing, we will continue to expand our capacity, as indicated, to test as many travelers as possible and as quickly as possible. We will have more to say on that in the very near future. This measure will be in place for a period of 4 weeks, and we will reassess the situation after this time. We know that this may sound very drastic to many listening, but we must avoid overloading our hospital system and our healthcare workers. I know we are all tired of this pandemic, but I must call on the solidarity of all Canadians. Our governments do have a role to play, but as citizens, we also have one to play, part of our individual responsibility. As a country, we need to increase the administration of booster doses and expand the use of rapid tests. In both of these cases, the federal government is responding to the requests of provinces and territories. The rapid tests are available, and deliveries for December have already started. 85 million tests had in fact already been sent to provinces and territories prior to December. An additional 35 million tests are being delivered to provinces and territories, the majority of which have already been received. Hundreds of millions of more tests will also be available following Minister Freeland's important announcement yesterday. Vaccines are also available and are being delivered to provinces and territories. 16 million of booster doses are available in stock, and many more are coming over the next few weeks. Our window of opportunity is small, but we have the power to change the course. Collectively and individually, we all have a role to play. And the key word for us, citizens and governments, is again the same: prudence. Thank you. Turning back now to Minister Freeland, I believe.
Oui, c'est vrai, Jean-Yves. Merci, Jean-Yves.
That's right, Jean-Yves.
Good afternoon, everyone.
Good afternoon.
As Omicron has reminded us, we're still living in a pandemic. And as we're learning, this is an even more transmissible variant of the virus. Yesterday, our government released an economic and fiscal update that outlines targeted investments that will give us the tools we need to finish the fight against COVID. D'abord et avant tout, les vaccins
First and foremost, vaccines are our best line of defense against the virus.
C'est pourquoi nous avons investi
That's why
plus de
we have invested over $7.3 billion
pour acheter des vaccins pour tous
to
les
buy
Canadiens
vaccines for
et
all
les Canadiennes
Canadians,
admissibles, y compris des vaccins
or rather all
pédiatriques.
Canadians who are
Ce
eligible,
montant
including
comprend
pediatric vaccines.
également l'achat
This amount
des doses
also
de
includes
rappel.
the cost of
Omicron
booster
makes
doses.
boosters more important now than ever. So please go and get your booster as soon as you are eligible. We have enough for everyone. The federal government is ensuring that third doses are free for all Canadians, as was the case with first and second doses. We're committing $2 billion to buy therapeutic medicines, including antiviral medications that will help prevent hospitalizations and save lives. If and when these medicines are approved by Health Canada, we already have agreements for 1 million courses of treatment from Pfizer and an additional 500,000 from Merck, with the option for an additional 500,000. Rapid tests are important too. They can help us break the chain of transmission. As we've just heard from Jean-Yves, and as I announced yesterday, we're investing a further $1.7 billion to procure and distribute a further 180 million rapid tests. These are being distributed free to the provinces and territories. Breaking the chain of transmission is critical in our fight against COVID. That's why we've introduced measures that will enable public health authorities to make the right call and, as needed, put in place restrictions to control the spread of the virus. We want public health workers, health officials, as they make these important and difficult decisions, to know that the federal government will be there to support workers and businesses. That's why in October, we announced the Canada Worker Lockdown Benefit and the Local Lockdown Support Program. These are two measures in Bill C2, which is working its way through Parliament and the Senate even as we speak. And respectively, these measures would provide direct support to affected workers and wage and rent subsidies to businesses subject to local lockdown protection. Nous comprenons que certaines restrictions de
We
voyage
understand that some travel restrictions will have an impact on tourism companies, for example, who have already gone through a very difficult time. Our tourism recovery program will provide wage subsidies and rent subsidies up to 75%. When we presented these new programs in October, we understood that they would cost $7.4 billion. But given the growing threat of Omicron, we have decided to earmark $4.5 billion more for those programs, as well as some other measures that are needed to control the spread of the virus.
I know that the rising threat Omicron poses is not something any of us want to be dealing with, especially now, just before the holidays. I know we are all tired. We are all tired of COVID. But I think we all also understand, after 21 months of fighting this virus and of doing a pretty good job as a country, that making hard decisions quickly and behaving carefully pays off. I also want to really reassure Canadians that we have, as a government, been careful and prudent. We have been putting in place measures, the measures that we will need for precisely this moment. We didn't know, of course, that Omicron specifically was coming in October when we proposed measures like the lockdown support program. But we did know that the fight against COVID was not yet over. That's why we have spent the autumn buying the necessary health tools we will need to fight this virus. And our economy and our public finances are in good shape. Canada is strong. We have the tools, the resources, and the national determination to handle this and to keep this virus under control. I know that Canadians are smart. I know Canadians are resilient. I know Canadians are careful. I trust everyone to do the right thing and to use their good judgment. And I am confident that together we can win this fight against COVID. Thank you.
Okay, did we have any further comments from the ministers? Okay, back to me. Thank you very much. All right, so just to let everyone know, we have a hard stop with the ministers at 2:15. I realize it's not a lot of time, so we're going to try and get through this quick. Ministers, if you can keep your responses to the questions as tight as possible, please, that would be great. Can I invite Raymond Filion from TVA to go up to one mic and Annie Bergeron-Oliver from CTV at the other. On va commencer avec Raymond Filion de TVA.
We'll start with Raymond Filion from TVA.
Bonjour, M. Duclos. Vous êtes un député du Québec. Vous avez parlé il y a quelques
Mr.
instants
Duclos,
d'une
you're from
fenêtre
Quebec, and you
d'opportunité
spoke earlier
petite.
about a
Vous avez
short
souligné
window of
qu'on ne manque pas de
opportunity.
vaccins. Est-ce que le Québec
Now, I'm
vaccine assez
wondering,
rapidement
is
pour la troisième dose?
Quebec
Par rapport à
vaccinating people
l'Ontario,
fast
Québec va
enough,
beaucoup moins
getting
vite.
those booster
Et,
shots out
la
fast enough
réponse est
compared to other
simple, parce que
provinces?
toutes les provinces doivent
Answer.
accélérer
Well,
leur
the answer is
processus
simple.
de
All
vaccination
provinces
de troisième
must
dose avec les
ramp
informations
up
que l'on
their
a maintenant,
booster
qu'on n'avait
shot
pas il y a
campaign.
à peine quelques semaines.
Now, with the
On s'aperçoit
information that we
troisième
have
dose est
now,
absolument
which we
essentielle
didn't
pour
have
protéger
before,
contre
we realize
l'infection et
that
contre le risque
booster
de
doses
maladies
are
sévères et
essential
donc le
to
risque
protecting against
d'hospitalisation.
Omicron and
Alors, c'est ce qu'on va devoir faire, c'est la
risk
priorité
of severe
première
illness and
pour toutes les provinces, y
hospitalization.
compris pour le
So
Québec,
this is a
d'augmenter
top priority for
considérablement
all
le
of the
rythme de
provinces,
vaccination.
including
Nous
Quebec.
avons
We need
présentement
to
un rythme
increase
de
the pace
vaccination au
of
pays qui est à peu
vaccination.
près le quart de ce qu'il était durant l'été.
The
Donc,
vaccination rate in the
l'été,
country
juin,
is
juillet,
about
août, on vaccinait
25%
quatre
of
fois
what
plus
it
de gens
was
par
last
jour.
summer.
Je pense qu'on a besoin d'arriver
So I
assez
think
rapidement
that
à
we
ce
need
rythme à
to
nouveau.
get back to that higher
Santé
level
publique
very
fédérale a
quickly.
été très claire au cours des
Question.
derniers jours. Les parties, des
Public
fêtes
health
à
was
5
very clear
personnes, c'est
recently.
pas une bonne
Parties
idée. Est-ce que c'est
with
un
20
message
people
que
or
le
more
gouvernement
are not a good
fédéral
idea.
a
Now,
donné
that's a
au
message from
gouvernement
Quebec.
Legault? Avez-vous
Is
dit,
this
M. Legault, que c'est pas une bonne idée
guidance
du
that
party à
the
20
federal government
20
gave to Mr. Legault?
L'annonce d'aujourd'hui, c'est que
Answer.
on voit rapidement à quel point la situation en dehors
Well,
du
today
pays
we
est
can see
grave
how
et s'aggrave
serious the
rapidement.
situation is
Donc, on est
outside
très
of the
inquiet
country.
de ce qui peut se
So we're
passer aux
very
voyageurs
concerned by
canadiens
what
à
could
l'étranger.
happen
On est
to
inquiet parce qu'ils
Canadian
peuvent se retrouver
travelers
dans des
abroad.
endroits où les
They may
situations
end up in
sanitaires
areas where
et
the
les
health
mesures de santé publique
situation
peuvent changer rapidement.
or health
On
measures
a
may
peur que
change
des
very
vols
quickly.
puissent être annulés,
We're
donc ils ne
worried that
puissent pas
flights might be
revenir. On a
canceled
peur
and
aussi
people
qu'ils
might not be
qu'ils
able to return
s'infectent
home.
du
We're also worried that they might
variant et de
contract
la
the
COVID.
variant.
Parce que les Canadiens doivent savoir que
Because
quand ils sont à
Canadians should
l'étranger
know that when
et
they are
qu'ils sont
abroad,
réinfectés par la COVID, ils ne
if
peuvent
they're
plus
infected
prendre
by
l'avion
COVID,
pour revenir au
they
pays.
can't
Donc,
get on a plane to come back to the country.
donc, je reviens à ça immédiatement. Donc, c'est l'annonce d'aujourd'hui. Mais c'est sûr que le virus, le
So,
variant Omicron, il s'en vient au Canada.
the
Il est déjà
Omicron
ici, bon, moins
variant
prévalent au
is
Québec qu'ailleurs pour
definitely
l'instant, mais il va se
here in
développer rapidement
Canada,
au
and
Québec
it
aussi.
will
Et
spread
même
in
si ça
Canada and
relève
in Quebec
évidemment
as
de
well.
décisions du gouvernement du Québec, c'est clair que l'annonce d'aujourd'hui
It's clear that
qui nous dit
today's
qu'ailleurs dans le monde, ça va de
announcement
plus en plus mal et que ça va arriver assez rapidement ici. Je pense que c'est un signal qu'au Québec, comme
is a
ailleurs au
sign
pays,
that in
on a
Quebec,
besoin
as
de
elsewhere
revoir
in the
nos
country,
mesures
we
de santé
need to
publique.
review our public health
Annie
measures.
Bergeron-Oliver from
Annie
CTV, and
Bergeron-Oliver
then I'll
from
have
CTV.
Abigail Beeman from Global come to the open mic, please.
Sorry about that. I didn't know it had to turn it on. My question is for you, Mr. Duclos. You mentioned in your opening remarks that Canada currently has 16 million booster doses in stock. That is not enough for every Canadian 18 plus to get a booster right now. Why weren't there more doses in stock, and what is the delivery schedule for future shipments?
Well, we have 16 million doses now in stock, either at the federal level or in provincial and territorial inventories. At the current rate, that's enough for many weeks of booster doses, and there will be many more millions coming in the next few weeks and in the next few months. So we have ample capacity to give booster shots to Canadians over the next weeks and months.
Okay, my second question is for you, Minister Alghabra. Minister Duclos hinted in his opening remarks that there will be changes in terms of testing for travelers. I'm wondering if the government is considering reinstating the testing requirement for Canadians who are heading to the U.S. for short trips of less than 72 hours.
As was stated by Minister Duclos, we are, given how fastly evolving the situation is, we're constantly reassessing. So when we feel we need to change our policies, we will announce it as quickly as possible. But for now, we are monitoring it and assessing it.
Okay, Abigail Beeman from Global is next, and then we'll have Boris Prou from Le Devoir to the other mic, please.
Hi, Minister Duclos. In your comments, you said this may sound drastic, but we must avoid overloading the healthcare and hospital system. I'm wondering what evidence you have that a non-essential travel ban out of the country is going to have an impact on community transmission or overloading hospitals and the healthcare system.
Today, we're really mindful of the situation of Canadians traveling abroad. And that's because we see the situation abroad, and we're afraid and concerned with what could happen to Canadians who would choose to be abroad in the next few weeks. The situation abroad is already dire in many places, and it's going to get worse very quickly. So we are afraid for what could happen to them if they chose to travel. And once they have left Canada, there is very little we can do to help them. So we want them to know that we are mindful of that and that we are advising them strongly not to travel for non-essential reasons.
I'm also wondering if you can shed any light on any conversations or messaging around interprovincial travel. What is your message to Canadians who are considering visiting family or spending the holidays in another part of this country?
Well, that will be for provinces and territories to assess. As we've said until now, and in part due to the fact that we acted quickly earlier at the end of November, we have been able to gain time. We have reduced significantly the importation of Omicron into Canada because of our very strict measures at borders. Among all comparable countries, we're in Canada one of the countries, if not the country, with the strictest border measures, the double and triple layers in some cases. So that helps us, that did help us contain the importation of cases. Now, we know that community transmission has started in Canada. It will accelerate over the next few weeks, and it will be for provinces and territories with the federal government to work together to establish what will need to be done by then.
Boris Proulx from Le Devoir, et après ça, Julien Lapointe de Radio-Canada.
Bonjour, Boris Proulx du Devoir. J'aimerais savoir, vous avez dit des mesures drastiques.
So I'd like to know,
J'aimerais savoir
you talked about drastic measures. To know, how exactly are they drastic? You said that you're going to change the travel advisory on the website, but that's it. And could you also tell me if you suggested to the provinces that they have a ban on international non-essential travel? Answer. Well, these measures are drastic in the sense that they send a strong message. Now, a lot of people like to go south for the holidays. I was one of those people. And a lot of people had planned such trips. And a lot of people are in the habit of going south. So I think this measure can seem very drastic to them because, after all of the time that people have spent at home, a lot of people would like to be able to get away. So I think it might be considered drastic in that sense. But it also sends a very strong message. I think people understand that we announced this measure today because we are concerned about the fate of Canadians traveling abroad, but also because it signals that there may be additional measures that need to be put in place along with the provinces and territories to further rein in the community spread, which is already happening. And finally, we discussed a number of options yesterday. There will always be new options that we will need to consider as the situation evolves. Question. Statistics show that very few people come back into the country with COVID-19. We're talking about 0.1% with all of the testing. So why is it important to focus on the borders in this way? Answer. Once a Canadian has left the country, they may end up in a faraway country, and there may be very little that the Canadian government can do to help them. A person could end up stranded because of the health measures that exist in that country, or there may be flights that are canceled, connecting flights that can't be made anymore. People may get sick, which is even worse, because once you're sick, you don't have access to your domestic healthcare services. So you have to try and take care of yourself and get care in a country that is not your own. That's not easy in normal times, but in a pandemic, it's even harder. So we're thinking of those people today as we announce this policy. Question from Julien Lapointe from Radio-Canada. And after that, Catherine Levesque from La Presse Canadienne. Would you consider eventually banning entry to foreigners entirely? Yes or no? We'll always do what people expect us to do, which is monitor the situation, work in collaboration with the provinces and territories, as the premiers were doing last night, because we want to be able to do the right thing at the right time. That's how we've worked over the past few months, and that's what we will continue to do. We will take the best action that we can with the information that's available to us. What would you say to Canadians who already have plane tickets booked, for example? Would you tell them to cancel? And what would you say to the airline industry that may end up with all of this disruption? Answer. We know this is difficult for airlines, for travel agencies, for families, for people who haven't been able to see each other for a long time, who had been dreaming of getting together over the next few weeks. What I'm saying is that with what we've seen happening around the world, and, you know, I've spoken about this with the other health ministers of the G7, things are getting much more complicated very quickly, at a rate that we couldn't have imagined a few weeks ago. We still know very little about the severity of Omicron in terms of the viral load. But what we do know is that the rate of spread is huge compared to Delta. So if you take the affected population and multiply that by the severity, it's possible that things could get very much worse very quickly. So there's a very high risk of hospitalization in many countries around the world.
Catherine Lévesque from La Presse Canadienne.
Catherine Lévesque from La Presse Canadienne.
After that.
Excellent. Bonjour, Monsieur Duclos.
Yes, good morning, Mr. Duclos.
Donc, on sait Omicron est dans une soixantaine
We
de
know
pays.
that Omicron exists in 60 or so countries so far. Why is Canada continuing to target those 10 countries in Africa? Why not extend those measures to other countries or eliminate them altogether? Answer. Well, there will be further clarification on this matter in the coming days, but today, what I really want to communicate is that we are concerned about what's happening elsewhere in the world. We have very little control over what happens in other countries, and so we are calling on people to be extremely cautious and to consider canceling trips abroad unless it's for essential reasons. Question. So you're making this announcement today, this change in the guidance, but reading between the lines, it seems to me that there may be more measures coming. Is that correct? Answer. There will certainly be other measures because the situation will continue to evolve. What we are announcing today seems to be the best response based on the information we have.
From the Canadian Press, and
Mary
we'll
Wolf.
wrap up in the room after that with Mylène Crête from the Press.
Could I ask Minister Duclos if you or the Prime Minister try to encourage provinces or territories to bring in other public health restrictions, such as limiting the capacity of gatherings? And if so, what was their response?
Well, I'm glad to be accompanied by Minister Leblanc, who is the Intergovernmental Affairs Minister. And Dominique, I'm sure you would have something relevant to add to that.
Merci, Jean-Yves. So the Prime Minister began the conversation with all of Canada's premiers by talking about the international circumstances, said, our concern, our shared concern about what can we collectively do to protect Canadians. The Government of Canada obviously has primary responsibility for the international border. The Prime Minister discussed a series of options that the government was considering with respect to the international border. We heard from premiers their views on international borders, but also their views on the evolving domestic situation within their jurisdictions. And the premiers, frankly, exchanged with each other as well some best practices or some suggestions around public health measures and what they could do around improving vaccine delivery, booster deliveries, and the availability of rapid tests. It was a very open and we think constructive conversation where I think all orders of government shared a common concern, but also best practices and what we can do to support another and Canadians in the coming weeks.
Could I also ask, you've talked about restricting non-essential travel and being prudent. I wondered if you thought there was a necessity for restricting a virtual parliament and having fewer MPs attending parliament when it comes back after the holiday.
That's a great question. The best person to answer that question would be Mark Holland, the House Leader. Maybe Omar has a view on that. I certainly believe that what was decided by our caucus yesterday was the right thing to do. Omar, do you have a view on that?
I can just add that parliamentarians will end up deciding how to conduct parliament. Obviously, we need to follow public health advice closely, and it will be up to parliamentarians to discuss it amongst themselves and decide how parliament will conduct itself.
Bonjour, Monsieur Duclos. J'aimerais savoir, vous avez dit que les Canadiens doivent considérer votre annonce aujourd'hui comme une pré-annonce d'autres mesures seraient à venir. Qu'est-ce qu'il y a dans votre coffre à outils? À quoi est-ce que vous songez?
What else do you have in your tool belt? What other measures are you thinking of?
Je crois que les gens ont compris que l'annonce principale aujourd'hui,
I think the people understood that the main announcement today concerns the concern that we have for Canadians who might be considering traveling abroad or who are perhaps already abroad. We are concerned for them. That said, I also want to mention what Minister Freeland was talking about, which is the importance of very quickly ramping up the booster campaign rollout. Just a few weeks ago, just a few days ago, actually, NACI issued guidance saying that after 6 months, it would be a good idea for everyone 50 and up to get a booster shot. And they also said that even younger people should be getting boosters as well. So even before Omicron was spreading this quickly, that was the recommendation of NACI.
Mais ce dont on s'aperçoit maintenant,
but what we're seeing now,
et le comité consultatif aura probablement l'occasion
and I think that NACI will probably be speaking about this soon, is that according to new evidence, 6 months is perhaps too long.
Donc, il pourrait être opportun d'accélérer
so it might be wise to accelerate booster dose administration even more and having them before the 6 month mark.
Il faut prioriser parce que les ressources sont
now, of course, resources are limited, so we need to set priorities. But perhaps an additional message I could communicate today is that we all need to work together, and the federal government will provide support to the provinces and territories to significantly increase the administration of those doses. Question. So essentially you want to see what the result of those two measures will be before you impose additional restrictions, is that right? You can correct me if I'm wrong. But, some Canadians probably have already bought plane tickets and will decide to travel regardless of today's announcement. Would you consider imposing a quarantine period when they return? Answer. All options are on the table. What we're saying today is that it's not a good idea to go abroad because we are concerned about what might happen to Canadians who do leave. We will continue to monitor the situation and to update the guidance as necessary.
Okay, I believe that... Oh, here we go. Test, test, there we go. I believe that is all the time that we have with the ministers today. Ministers, I will let you go. Thank you so much for joining us. Are we able to just confirm, do we have the doctors for a couple more minutes? I believe that's the case. Yes. Okay, so we'll take 15 more minutes of questions with Drs. Tam and Dr. New as well today. I believe we have one more question in the room here, so we'll start with Marco Belair from Le Devoir.
Oui, bonjour. Alors, ma question
Yes, good
s'adresse
afternoon.
à Dr. Tam.
My question is for Dr.
Êtes-vous,
Tam.
Au diapason du gouvernement fédéral, est-ce que, selon vous, la
Are you in line
décision
with
prise
the
aujourd'hui, les mesures
federal
prises
government
aujourd'hui
here? Do you believe that today's
face à la progression
announcement
des cas de COVID-19 au Canada?
will help reduce the spread of COVID-19 in Canada?
Oui, je peux commencer. Peut-être Dr. New va
Answer,
ajouter
yes.
quelque chose.
I'll start and perhaps Dr. New will add to my answer.
L'annonce le gouvernement aujourd'hui, c'est
The government's
d'éviter
announcement
des
today
voyages à l'étranger non
concerns
essentiels.
limiting
Mais il y
travel
a
abroad
beaucoup plus de choses
to essential travel only.
a besoin de faire pour augmenter notre
There are a number of things we need
couche
to
de
do
protection aussi dans la
to
situation
add
domestique.
further layers of protection
Donc,
within
on a
Canada.
travaillé vraiment étroitement avec
So we worked
notre
very
homologue,
closely with
les
our
autres
counterparts,
chefs de santé publique
the other public health officers
dans le dernier
of
quelques
the
jours.
provinces and territories.
On a discuté de réduire de contacts.
And we talked
pendant les
about
vacances
reducing
et d'autres
contacts over the
mesures,
holidays, as well as other
tout
measures.
incluant la vaccination de doses rappel,
We talked about booster
aussi les autres
doses,
mesures pour la protection communautaire et individuelle. Dr. New va ajouter
and
quelque
other
chose.
layers of protection.
OK, merci,
Dr.
merci,
New will
Dr.
add something,
Tam.
I
Oui,
believe.
comme Dr.
Yes,
Tam
thank
a
you, Dr.
constaté,
Tam.
on parle toujours des plusieurs couches de protection
As
pour
Dr.
la
Tam said, we
population
always like to
canadienne.
talk about
Donc,
different layers of
pour le
protection.
gouvernement fédéral, on est responsable pour les frontières
The federal government
internationales.
is
Et
responsible
c'est
for
quelque
dealing
chose, les
with national
mesures, et
borders.
aussi qu'est-ce qu'on fait pour une avis
So
pour
that's one
dire que ce n'est
aspect.
pas une bonne idée de voyager à l'étranger. C'est pour ralentir aussi la propagation, peut-être
And
l'importation
this
des
guidance
cas
concerning
de
non-essential
COVID-19
international travel could help
et surtout aussi
slow the
le
spread of
variant Omicron.
COVID-19,
Mais il y a beaucoup de
particularly
choses qu'on peut faire
the
aussi
Omicron
au sein
variant.
du Canada.
But there
Et
are
donc,
also
je
a lot of
pense
things that we can
on a
do
constaté
inside
aussi, souligné
Canada.
à plusieurs reprises
I
qu'il y
think
a plusieurs couches.
we've
Première chose, c'est
seen
toujours
clearly
l'adoption des
that
vaccins.
the
On travaille
first layer
étroitement
of
avec nos
protection
homologues
is
des
always
provinces et territoires
getting
pour
vaccinated.
augmenter la
We've
couverture
worked closely with the
vaccinale
provinces and
partout dans le
territories
pays.
to improve
Pour
vaccination
les deux
rates
doses
across the
au
country.
début, une série primaire, et maintenant, on parle aussi
First of all,
maintenant
for the first two
de
doses, and now,
augmenter,
of course, we're talking
accélérer
about
l'adoption des vaccins,
accelerating
de doses de
the
rappel
rollout of
pour les
third
personnes ou
doses
les populations prioritaires. Ça, c'est
for
numéro un.
those who are
Deuxièmement,
in the priority
on
populations.
parle aussi des mesures individuellement
Then, of
aussi
course, there
à
are
l'échelle de la
individual
communauté.
measures
Qu'est-ce
that
qu'on
can
peut
be
faire
taken.
peut-être pour aussi diminuer le risque de propagation?
There
Donc,
are
je
things
pense
we can
que
do to
toutes les
reduce
bonnes
the
mesures à
spread.
l'échelle
So I think
individuelle,
all
comme
of these
le port
good
de masque,
measures like
la
wearing
bonne hygiène des
masks,
mains,
practicing
peut-être
good hand
vraiment
hygiene,
réfléchir qu'est-ce qu'on peut faire pour les rassemblements en famille
thinking
pendant
about
les
how
fêtes. Ça, c'est
to
quelque chose,
reduce
je
the
pense
number
que
of
c'est très
people at
important.
family
Peut-être que
gatherings
je
during the
peux
holidays,
peut-être
for example.
donner quelques mots. Je
These
pense que
are all important.
c'est pas une chiffre magique. Je pense que
On
tout
the
le monde
subject
pense,
of
OK, c'est quoi
family
le nombre de
gatherings,
personnes pour un
you know, there's no
rassemblement en
magic
famille? Je
number.
pense que c'est vraiment pour une auto-évaluation dans chaque famille, une bonne
Each
conversation
family
honnête,
needs to have an
parce qu'on
honest
sait
and
dans
open
une famille, peut-être
conversation
qu'on a à quelques années,
about
peut-être
what
des
people are
personnes plus à
comfortable with.
risque, plus vulnérables.
Within any
Je
family, there
pense
may be people
au
who are more
début,
at
c'est
risk.
important vraiment
And I think it's
d'avoir
important
tout le monde
to
complètement, doublement au moins vacciné pour un rassemblement
look
en
at
famille.
things
Donc,
like,
ça,
is
c'est
everyone
numéro un.
vaccinated, for example?
Deuxièmement, je pense que c'est aussi une bonne idée de
Secondly,
parler honnêtement.
it's
Est-ce que
also
tout
a
le
good
monde est à
idea
l'aise peut-être
to have an honest
avec le port
conversation
de
about
masque, peut-être
how
parce que
comfortable
si,
people are wearing
si
masks, for
on
example.
a aussi une autre couche de protection
Because
avec
that's another
des
layer
portes de
of
masque
protection.
bien
construit, ajuster, c'est
if
une autre
everyone
couche de
has a
protection.
properly
Finalement
constructed
aussi, si on peut diminuer le nombre de
mask that fits
personnes
well,
dans un rassemblement en famille,
that's
on
an
peut aussi
important
garder
factor.
beaucoup de, peut-être plus de distance entre,
It's also possible to
des
practice
membres
some
dans le
physical
rassemblement.
distancing
Et aussi, on a
at
parlé
these
des
gatherings.
ventilations. C'est peut-être une bonne idée aussi pour faire
Ventilation is
circuler
also
l'air
important.
à l'intérieur, de peut-être aussi
It might be a
ouvrir
good
les fenêtres
idea
peut-être
if
pour
people are
quelques
gathering
minutes
inside to
tous
open the
les
window
heures
for a
pendant le
few minutes
rassemblement. Ça, c'est
every
des
hour.
choses. Mais aussi primordial, je pense aussi, il faut
But
souligner le
the
point
most
ici.
important thing
On a des symptômes, on est malade.
is that if you have
C'est pas une bonne
symptoms,
idée. Il faut vraiment
if you're
rester à la
sick,
maison. Je
you
pense
really
que
do need
tout le
to
monde
stay
va
home.
comprendre et aussi bien apprécier
And I think
le
everyone
geste de
will
rester à la
understand
maison
that if you do
si on est
and
malade et
appreciate that.
symptomatique. Donc, ça,
If you're symptomatic, you
c'est
should
ça
stay
ce qu'on peut
home.
faire comme dire. Comme famille,
So
comme
that's
individuel,
what you
mais
can
aussi,
do
je
as
pense que c'est
individuals
aussi important de
and as families.
toujours suivre les consignes des
And of course, it's
autorités de
always
santé
important to
publique à
follow
l'échelle locale
public
parce que
health
c'est eux
guidance
qui
because
connaissent mieux c'est
the
quoi la
local health
situation
authorities
épidémiologique et si
understand the
c'est
local
possible
epidemiological situation
peut-être
best.
nécessaire, les autorités vont aussi ajuster les mesures de
And
santé
local
publique.
authorities will
Je
adjust
vois
health measures
à l'heure
as
actuelle
necessary.
que dans plusieurs régions, des médecins hygiénistes à l'échelle locale ont déjà, comme dit,
I know that in some areas, local health authorities have already revised some of their guidance in order to respond to the spread of Omicron within their jurisdictions.
Donc, en clair, il n'est pas nécessaire,
Question.
selon vous,
So, to be
de
clear,
fermer la
according to you, it is not
canadienne
necessary
ou
to
du moins
close
de
the
ne
Canadian
permettre que les
border
voyages
or
essentiels.
to only allow essential
Est-ce que j'ai
travel.
bien compris?
Is that correct?
Ça, c'est, il y a deux parties. Oui, premièrement, c'est très
Well,
important
there are two parts there.
d'avertir les Canadiens
First of all, it's very important to
pas faire les
warn
voyages
Canadians, to
non
advise
essentiels
Canadians
à l'étranger.
not to
Et
conduct
pour les
non-essential
personnes qui
travel
rentrent au Canada,
abroad.
oui,
And for
on
people
peut
coming
faire
into
ce qu'on peut
Canada,
faire pour peut-être ralentir
yes,
l'importation, la
the goal
propagation,
is
mais
to
ce qu'on
slow
voit
the
actuellement,
spread.
le variant Omicron est
But,
déjà ici partout
you
dans le
know,
pays. Donc,
Omicron
je
is
pense
already here in the country.
peut-être que c'est très
So,
important, mais même plus important dans quelques
I think
régions au
it's
Canada,
more
de
important
vraiment faire les choses nécessaires pour protéger la
really
population
follow
au sein
public
des
health
communautés
measures
avec les mesures nécessaires parce
communities.
qu'on voit maintenant actuellement plusieurs éclosions
Because we've seen a
dans
number of
plusieurs
outbreaks
contextes dans
in
les
a number of
provinces
different
et territoires.
contexts
Donc,
in the
je
provinces and
pense que ce n'est
territories.
pas seulement une question qu'est-ce qu'on fait
So it's
à
not
la
only a
frontière, mais
question of what's
qu'est-ce
being done
qu'on
at the
fait
borders,
ici au
but
sein
of what's
des
being
communautés
done
à l'échelle locale.
within communities on a local level.
Okay, I believe we have questions on the phone as well. We'll take one question, one follow-up. Operator, we're going to wrap things up at 2:30, so if I can hand that over to you, and if it's possible to prioritize press gallery, parliamentary press gallery members, please do so.
Thank you. We have a first question. La première question is de Ryan Tumulty from National Post. Please go ahead. À vous la parole.
Yeah, I'm wondering for either of the doctors if you could say what you feel is a greater risk when it comes to the spread of Omicron, the concert venues and NHL arenas that are currently operating with full capacity or international travel.
It's Teresa Tam. So I think it depends on what people will be doing when they are going into another country. And that could well be another mass gathering, which is ill-advised. At this point, given what we know about the Omicron virus, which is very transmissible, I think that our recommendation is don't have mass gatherings. I think Canadians work really hard. They've got fully vaccinated. There's vaccine passes. But at this point in time, what we know is that even if you have 2 doses, there's a possibility you could be infected and spread to others, even though the vaccine seems to have good protection against serious outcomes. It's preliminary, the results. So this is a matter of prudence. We've seen super spreading events in a number of sports-related events already. So I think that there's no reason that I would think it will be different than any other mass gathering. You can reduce your risk, but you can't, likely you won't be able to reduce it completely. So as a matter of precaution, avoid mass gatherings.
Yes, it's Dr. New. I would just underscore the point that you asked about, I guess, professional sports. I think we all get it. You know, it's entertainment. It's also it's big business. But at the end of the day, it's a lot of people gathering indoors, especially to witness professional sports. And I think if you look at the principles in terms of physical distancing, the use of face masks and so on, I think if you take all that into account, at the present time, if I understand, let's say sports events, arenas, hockey arenas are still at full capacity, that's something I think that needs to be looked at.
Okay, operator, do we have the next question?
Yes, we do. From Mary-Kate Walsh, the Globe and Mail. Please go ahead. À vous la parole.
Hi, thanks for taking our questions. Can you please clarify the advice that you are giving the government? Do you agree that there should be no on-arrival testing for anybody from the U.S.?
Well, just clarify that unvaccinated individuals are tested, and there's also mandatory random testing even for vaccinated individuals. So I think just to clarify that point, from the United States, there's air and land, and measures and layers of protection are already in place. So I think the situation is evolving, and more countries have Omicron. So I think one of the other colleagues have mentioned is really what is the impact of international travel versus domestic. I think this week there's a pivot towards domestic response because we now know that the virus is in our community and much of our public health resources have to focus on that. At the same time, the federal government, being responsible for the international border, is still considering layer on more protection. So you heard one of them today in terms of advising against non-essential travel. And I think that there's other measures being under active discussion at this point.
Yeah, and Dr. New, I think I'll just answer the question directly. I think, America, what you said is that, Dr. Tam, myself, others, in terms of the scientific information, the data, we take that all into account and we give our best advice to ministers. But obviously, there's this cabinet confidence. We give our best advice. At the end of the day, decision makers make their decisions. So I think I'll just leave it at that. Obviously, everything's in the mix. We work well with our colleagues in the provinces and territories, internationally, and so on, to put together the best advice we can based on the science. And then, of course, decision makers take that into account, but we recognize that there are other considerations in play as well beyond just a strictly sort of technical public health advice that we may be giving to ministers.
And so what is the scientific rationale for keeping the ban on 10 African countries, including the third country testing requirement for some of these countries, when there is community spread in Canada and it's already here, and meantime our allies are lifting that exact country ban? What is the rationale for keeping it?
It's Dr. New. I'm not saying there's a rationale one way or the other. I just, as I just said, and Dr. Tam can add to it, is that we're obviously monitoring the situation. We have the sort of the data. We're seeing what's happening both here in Canada domestically, internationally, and that data, that advice, information is given to ministers. And I think, as Minister Duclos said, that ministers in the cabinet, the Prime Minister, everyone is looking at all of that data and taking other factors into account and carefully considering and potentially, I say, other decisions may be forthcoming. But it's not a yes and no in terms of what the ministers presented today.
Yes, Teresa, I'll just have to add that what you've just indicated, Marika, is a very important point. And I think this is a policy that needs to be revisited, and that there is an active examination of that situation, seeing as this virus is in many countries. Secondly, we do have our post-arrival tests, and we have detected higher positivity rate from certain countries in amongst the 10 that are currently for which enhanced travel measures have been implemented. But I think it is very important for us to re-examine that policy.
All right. Unfortunately, that is all the time that we have today. It's 2:30, so we'll have to let the doctors go. Thank you, everyone, for joining us today, and thank you, doctors, Dr. Tam and Dr. New, for taking our questions.